Hi, everyone. Welcome back to another session for the NCLEX review. I'm sorry that we have some technical difficulties and we are quite delayed this time. So we are on day 84 out of the 90 days free NCLEX review series, and we're also inviting everyone to enroll to our NCLEX review at nclexcoaching.com. And so let's get started with our Q&A today. Now, we'll start here with our bow tie. This is about a case of a patient of, this is an eye disorder. And so here's a scenario. It states, the nurse reviews documentation for a 42-year-old patient who was brought to the ophthalmologist by a coworker. So we'll take a look into the nurse's notes at 10:15. The patient arrived by car accompanied by a coworker to the emergency department, and the patient reported that while in a meeting at work earlier that day, they suddenly noticed shooting stars in their left eye, followed by feeling like a curtain was being drawn over the outer edge of their vision. They denied experiencing any pain, and the patient has no significant medical history. Vital signs are temperature 98.2 Fahrenheit, respirations 18, blood pressure 126/90, and oxygen saturation of 98 room air. The patient is alert, oriented to person, place, time, and situation, and has strong, equal movement in all extremities. Pupils are equal, round, reactive to light and accommodation. Cranial nerves are intact. Both conjunctiva are clear, and the sclera is white. The ophthalmologist has seen the patient. Now, I really want you to look into the nurse's notes and capture those abnormal assessment findings. Now, your task this time is to identify the possible condition that the client may be experiencing, and also to nursing interventions to address the condition. And you also need to supplement 2 parameters to monitor for assessing the client's progress. All right, so have another glance into the nurse's notes, and then we'll tackle this bow tie question. Now let's move on into here in answering this question. So we have the following selections for the potential condition. We have the myopia, cataract, retinal tear, open angle glaucoma. We have selections for the nursing actions: administer eye drops to prevent the pupil from constricting and adjusting focus, cover both eyes with patches, get ready for laser photocoagulation. We also have suggest wearing glasses to improve vision, and position the patient in Trendelenburg's. And we have the parameters to monitor: signs of eye infection, fluid discharge around the protective eye shield, and development of a cloudy appearance in the eye, and vision clarity with new glasses, and pupil constriction to light. Now, what do you think is going on in this patient based on the scenario? For those who just joined us, welcome to our session today. We had some difficulty earlier, technically. So let's answer this question. So the potential condition that this client is experiencing is retinal tear. Okay. The client's description of seeing shooting stars, and then followed by the sensation of a curtain coming over their vision. This is signifying that there is retinal tear or possibly retinal detachment. And please take note that this is a medical emergency. Okay. And this is going to cause some sudden visual changes. It's going to be painless, as described in the scenario, right? Now, why not open angle glaucoma? Why not this one? Well, we know that with open angle glaucoma, it typically develops slowly, right? It is progressive, and the loss of vision is going to be gradual as well. It is painless. We're not selecting open angle glaucoma. Now, what about the cataract? This is also incorrect. We know that the cataract is going to involve gradual clouding of the lens. It can lead to the blurring of vision, dimmed vision, and also it doesn't involve this shooting stars in the client's verbal report, like what he said. So cataract here is unlikely diagnosis or condition for this scenario. Now, for the myopia, it is also incorrect. This is nearsightedness. So this is difficulty seeing distant objects clearly. And this is an error of refraction. So it's not a sudden event. So that's why we are eliminating the myopia as well, along with the cataract and open angle glaucoma. Now, what are the two nursing actions that you should include in this question? These are to get ready for laser photocoagulation and cover both eyes with patches. Now, why you're going to prepare this patient for laser photocoagulation? This is the known treatment to repair for the retinal tear or the detachment, and this is to prevent further damage or loss of vision. Now, if you selected cover both eyes with patches, this is intended to minimize eye movements, and this is going to prevent further damage to the retina in the affected eye. So you're going to cover both eyes with the patches. Again, this is to minimize eye movement. Now, why not administer or let's say position the patient in Trendelenburg position? This is not intended in this case scenario. This is the position that you're going to be doing or you will be applying whenever your patient is in hypotension, or let's say if they're having hypovolemic shock. This is not appropriate for retinal tear or detachment because this can increase the intraocular pressure. It can exacerbate the retinal detachment. So nothing about Trendelenburg positioning. Now, if you suggest wearing glasses to improve vision, we know that glasses can correct refractive errors like myopia or hyperopia or astigmatism, but this is not suitable for this condition. Your patient in this scenario is having that sudden onset of visual disturbance caused by the retinal tear, so this is not going to correct this. Now, if you selected administer eye drops to prevent the pupil from constricting and adjusting focus, we know that certain conditions like uveitis or maybe iritis, these conditions may benefit from the medications that can inhibit pupil constriction. But the medications that is involved here are not going to treat the retinal tear or the detachment. Okay, so our goal in this case is to stabilize the eye and also to prevent the movement and also to decrease the pressure inside the eye as well. Now, what are the parameters to monitor that you need to select here? We have the following selections: signs of infection and pupil constriction to light. So these are the correct answers. So after the procedure, we're talking about the photocoagulation, laser, or any kind of surgical procedure that will be done for the retinal tear. It is very important for us to check the patient for any development of infection because this can also complicate their recovery. Now, if you selected pupil constriction to light, this is also correct because we need to find out if the pupil will be able to function well, respond to the light, and ensuring that there is no further damage and also any issues that can affect their vision. Now, why not fluid discharge around the protective eye shield? Why this is not the selection? Because this is this is more relevant in post-surgical cases like cataract surgery, or when there is an issue of infection after another set of invasive procedures. But this is not something that you will be monitoring for this case. Now, if you are going to expect, let's say, for example, if the patient has the laser therapy for the retinal detachment, the drainage itself is not typically the indicator for monitoring the progress of the retinal tear. Okay, we are going to look for those signs, the uh, the function of the retina as well. So this is not what we're going to be looking for. Now, why not development of a cloudy appearance in the eye? This is incorrect because this is a sign of cataract formation, right? Wherein there is opacity of the lens. And this is not relevant in the acute symptoms described in this case. And let's have another one. Vision clarity with new glasses. This is something that you will be doing if there is issue with refraction for myopia or maybe hyperopia. So this is not appropriate for this case. Now let's move on to our next question, number 2. What symptoms should the nurse expect in a client with a possible retinal detachment? Select all that apply. A, flashes of bright light. B, reduced visual field in the affected eye. C, a sensation of a curtain covering part of one eye. And D, slow progressive changes in vision. And also E, intense throbbing pain in the affected eye. You're going to select all of those appropriate options. So the correct answers are the following. Letters A, B, C. One of those will be flashes of bright light. This is what we call as photopsia. This is a manifestation of retinal detachment as the retina will start to pull away from the choroid. Now, letter B, reduced visual field in the affected eye. This is also correct because the detachment can impair the vision in the affected area. It's not going to affect the other eye when there's no tearing or detachment in the other eye. Now, if you selected letter C, this is also incorrect. The sensation of a curtain covering part of one eye. Or maybe they're going to say something about shadowing, covering part of their visual field. And this is another hallmark symptom. Now, letter D is incorrect. Slow progressive changes in vision. This is incorrect because we know that retinal detachment can become sudden. It's not gradual in affecting the vision. Okay, so if you're going to select that one, slow progressive changes in vision, this is more appropriate to cataracts or let's say the open angle glaucoma. Now, if you selected letter E, intense throbbing pain in the affected eye, the retinal detachment is usually painless. So the throbbing pain is making this statement incorrect. This could be a sign of or a symptom of a possible infection, or it could be the close angle glaucoma. Okay. Now let's have another item, number 3. What post-operative care instructions should a nurse provide to a client after retinal detachment surgery? Select all that apply. A, notify your healthcare provider if you experience sudden eye pain. B, report if the pupil in the surgical eye stays dilated. And C, refrain from activities that require focusing on near objects for the first week. D, avoid activities that can raise intraocular pressure. And E, inform your healthcare provider if your vision suddenly worsens. What do you think? What will be your answers? The correct answers are letters A, B, C, D, and E. All of these options. So letter A is correct. Whenever there is sudden eye pain after a retinal detachment surgery, this signals complication. It could be an increasing intracranial, or not intracranial, but intraocular pressure rather, and this will require immediate attention. And if you selected letter B, that is also correct. If there is persistent dilation of the pupil, this can indicate that there is nerve damage. So this is supposed to be reported by the patient. Again, and also letter C, refrain from activities that require focusing on near objects for the first week. So this will encompass those activities like reading or close-up work, which can strain the eye. So this can also slow down the recovery. And letter D, this is also correct. So activities, let's say bending, lifting heavy objects greater than 10 pounds, also straining, Valsalva's maneuver, coughing, sneezing. This can also increase the intraocular pressure. So this can also affect the healing of the surgical site. And same thing with letter E. A sudden decline in the vision can also be a signal that there is failure in the repair. So this is supposed to be reported to the surgeon as well. Okay. Again, our focus in this test question is to remember what those teaching should be shared to our patient and to make sure that they know those possible complications, signs and symptoms of possible complications that might arise after they get the surgical procedure. Okay, so these are possible signs of intraocular pressure increase and also delayed healing, slowed healing of the operative site. Let's have number 4. A 45-year-old patient had a pneumatic retinopexy for a right retinal detachment. What should the nurse include in discharge instructions? A, the use of eye patches to limit eye movement. B, the use of dark glasses to protect the eyes from bright light. C, the reason for keeping the head in a prescribed position. And letter D, instructions for changing the eye dressing if it becomes soaked. We're talking about a specific procedure, which is the pneumatic retinopexy for a right-sided retinal detachment. The correct answer here is letter C. The reason for keeping the head in a prescribed position. After the procedure, the patient should keep their position in a specific spot as ordered. So most of the time, they're gonna be required to lie face down or prone, or maybe a slight angle to help the gas bubbles to stay in contact with the retinal tear. Again, this is specific to the pneumatic retinopexy. It will not be applicable to other surgical procedures, okay? Again, we are only talking about pneumatic retinopexy, so they should maintain that position, such as maintaining face down or prone position. Again, the reason for this is to help the gas bubble to stay in contact with the retinal tear. And this will promote the bubble in pushing against the retina effectively. So in some cases, the patient might also be asked to lay on their side opposite to the affected eye. And it depends also on the location of the retinal tear. Now, what is the pneumatic retinopexy is? Well, what is this? Well, basically, this is a procedure wherein there is going to be injection of a gas bubble into the eye in order to help reattach the detached retina. And so, again, after the procedure, the patient will be instructed to maintain the specific head positioning. It could be prone position or maybe slightly lateral to keep the gas bubble in the correct location against the retinal tear. And aside from that, the patient will be instructed to take their eye drops or medications, and also, of course, follow-up visits in order to monitor the healing process. And so let's take a look into letter A, the use of eye patches to limit eye movement. We know that the application of eye patches to both eyes is important pre-operatively, and the reason for that is to limit the movement, right, in order to lessen the intraocular pressure rise. But post-operatively, especially for the pneumatic retinopexy, this is not required because the procedure does not involve a major eye movement restriction. Now, if you selected letter B, the use of dark glasses to protect the eyes from bright light, we know that bright light can be bothersome after the surgery, but wearing dark glasses is not really a standard requirement for this procedure. Okay. Now, if you selected letter D, instructions for changing the eye dressing if it becomes soaked, eye dressings are typically not soaked after this type of procedure, so frequent changes is not necessary. Okay. It's not going to involve this issue. So I hope that you're following with what I'm talking about. This is on the pneumatic retinopexy. Let's head into our next question. Number 5. A client in the emergency department reports being struck in the right eye and describes a curtain coming over part of the vision. What should the nurse report as the priority? Is it A, the client complains of a headache on the right side? B, there are broken blood vessels. There are broken blood vessels in the sclera of the right eye. And C, the area around the right eye is bruised and tender. And D, the client reports seeing a curtain over part of their vision. What should the nurse report as a priority? The correct answer is letter D. This description basically is the key indicator that the patient is having that retinal detachment. So this will require prompt treatment to prevent permanent vision loss. If you selected letter A, the client complains of a headache on the right side. This is a common manifestation after a trauma, but it is not as urgent as the changes in the vision that could indicate a retinal detachment. Now, if you selected letter B, subconjunctival hemorrhage this is really what it is. The subconjunctival hemorrhage or broken blood vessels. This can occur from a trauma, but it does not signal an emergency such as the retinal detachment. And same thing with letter C, the area around the right eye is bruised and tender. This is expected if your patient had the blunt trauma, but it is not going to be as urgent compared to the sudden vision changes. Like they reported having that curtain coming over. Okay, so your strategy in answering this question is to prioritize that visual change that can result in the permanent damage, which is basically the sign, that curtain coming over in the patient's visual field. All right, let's have number 6. A 55-year-old patient presents with a sudden loss of peripheral vision in the left eye. What action should the nurse take first? Now let's take a look into the history. Patient has type 2 diabetes mellitus. There's also mild hearing loss. There's sudden loss of left eye peripheral vision today. And the physical assessment included perla, extraocular movements intact, and cerumen obstructs view of tympanic membranes, and the patient's vital signs are the following: pulse rate of 100 beats per minute, blood pressure 144/89, respirations of 22 cycles per minute, and temperature of 97.9 Fahrenheit. Now, the options are the following. A, check the patient's blood glucose level. B, measure blood pressure in the left arm. C, irrigate the ear canals to clear earwax. And D, notify the healthcare provider of the vision change. What will be your answer as a priority action? Loss of peripheral, sudden loss of peripheral vision. What do you think? Well, the correct answer here is letter D. If there is a sudden loss of peripheral vision, this is a potential sign that there is retinal detachment. This is going to require immediate treatment. Now, if you selected letter A, check the patient's blood glucose. It's important for a patient that may have diabetes, but The vision changes that is happening is indicating retinal detachment. This is going to take much more priority in this scenario. If you selected letter B, measure blood pressure in the left arm, it's not really related to the vision loss and it does not take priority. And looking into the patient's blood pressure, 144/89, it's elevated, but it's not critical. It's not gonna be as significant compared to the patient's sudden loss of peripheral vision, which can lead to permanent visual loss. Okay. Now, if you selected letter C, irrigate the ear canals to clear earwax, this is not going to address the urgent concern, which is the sudden loss of peripheral vision. Again, your goal here is to prioritize in treating the possible occurrence of retinal detachment, which can lead to permanent visual damage. Okay. The other assessment, glucose checking, blood pressure checking, clearing the earwax. This can be done after our major issue is treated. Let's have our number 7. When a client is diagnosed with a detached retina in the emergency department, what action should the nurse take first? Is it A, apply compresses to the eye, B, instruct the client to lie face down, C, remove all bed pillows, and D, encourage measures that limit movement? Your patient has retinal detachment. What will be your initial action? We already talked about this. This is to do letter D, encourage measures that limit movement. Okay. Your patient should be kept in bed, and also application of the eye patches as well. This is to prevent detachment of the retina before the surgery. And if you selected letter A, apply compresses to the right eye, we can do the cold compresses to the eye, especially the right side, after the surgery. And this is to help in the healing process, but not before the surgery. Okay. And this is not really going to help the stabilization of the retina. It's not. Our goal in the acute phase is to limit the eye movement to prevent increase in the intraocular pressure, and also to decrease physical activity this time. If you selected letter B, instruct the client to lie face down, this is not appropriate this time. This can potentially worsen the retinal detachment. We already talked about that prone position. That was about the surgical procedure, right? It could be done in the retinopexy or in a procedure, let's say gas tamponade, in the post-operative phase, but not applicable in the pre-op phase. So they should not be lying prone before the procedure. If you selected letter C, remove all bed pillows, we need to avoid this. This is irrelevant. What we need to do here is to limit the client's movement. Okay. So removal of the pillows, it doesn't also play a role in achieving the prevention of more issues inside the internal structures. So again, we're going to eliminate that one. Let's have number 8. When a client with retinal detachment expresses fear of going blind, what should the nurse keep in mind before responding? Is it A, surgery cannot be repeated, so failure leads to blindness? B, surgery only delays blindness in the right eye, but the left eye remains unaffected? C, services are available to help newly blind individuals adjust? And D, surgical treatment has a 90 to 95% success rate. Again, the question here is, what should the nurse keep in mind before responding, especially that they're expressing fear of going blind? The correct option here, it is letter D. The surgical treatment has a 90 to 95% success rate, and this can help assure the patient that blindness is not inevitable as soon as they're getting that treatment. Now, if you selected letter A, surgery cannot be repeated, so failure leads to blindness. It's false because the retinal detachment surgery can be repeated if in case the initial procedure is unsuccessful. Okay. In some cases, a second surgery can be done within 10 to 14 days after the first attempt. And so the failure in the first surgery doesn't immediately lead to permanent blindness. There are other opportunities for additional intervention. So eliminating letter A this time. If you selected letter B, surgery only delays blindness in the right eye, but the left eye remains unaffected. This misrepresents the goal of surgery because the purpose of the surgery is to prevent blindness in the affected eye, not merely delaying it. And we know that with a successful surgery, it can fully restore the vision. It can also stop further deterioration in the affected eye. Now, if you selected letter C, services are available to help newly blind individuals adjust. We know that the services are available, but this option does not address the client's fear of, or it will not be able to, it's not going to provide reassurance about their current situation. Our focus around this time is to maintain that likelihood of a positive surgical outcome rather than discussing their resources for coping. This is like kind of like morbid, actually. You are expecting that they're going to get blind sooner. So the client's concern is about avoiding blindness. And again, this is something that we need to emphasize. We need to reassure and also provide comfort and also provide optimism that the surgical procedure will be effective. Okay? We need to address the client's concern here. Number 9, for a client with a detached retina, what is the expected result of patching both eyes? We already asked this earlier, right? Letter A, reduce rapid eye movements. B, decrease irritation caused by light. C, protect the injured eye from infection. And D, rest the eyes to promote healing. The correct answer here, it is letter A, reduce rapid eye movements. It will minimize the involuntary rapid eye movements, which can worsen the retinal detachment. It can also add strain to the retina. And limiting the eye movement is very important to prevent further damage. Now, if you selected letter B, decrease irritation caused by light, well, light sensitivity may happen with a detached retina, but patching the eyes is not primarily intended to address the irritation. Okay, that is not the reason for application of the patches. The main goal of the application is to reduce the eye movement. It's not to block light or decrease irritation caused by it. If you selected letter C, protect the injured eye from infection, the patch is not primarily intended to prevent the infection because there are other different interventions that can be done, such as maintaining hygiene, using medications like those antibiotic eye drops. And if you selected letter D, rest the eyes to promote healing, we know that resting can indirectly contribute to the healing, but the purpose of the patching, again, is to limit the eye movement. Okay? We need to rest the eyes because it's already detaching. Now let's have number 10. Which statement best guides the client's activity level during recovery from retinal detachment surgery? Is it A, activity is resumed gradually with full recovery in 5 to 6 weeks? B, activity level depends on client tolerance. Clients can be as active as they wish. C, activity is restricted for several months, requiring sedentary lifestyle. And letter D, clients can resume normal activity and aerobic exercise soon after surgery. The correct answer here is letter A. There should be gradual resumption of the patient's activities because the full recovery is expected to happen after 5 to 6 weeks. Again, the key here is to educate them about gradually resuming their activities. Again, preventing them from doing strenuous or vigorous activities, bending, doing any more of the lifting. That's a big deal. We don't want them to lift objects as heavy as 10 pounds or greater, straining, Valsalva's maneuver, coughing, sneezing, all those things. Okay. Now, if you selected letter B, activity level depends on client tolerance. Clients can be as active as they wish. Well, the activity should not be based on the client tolerance alone, because we know that there are set of restrictions that should be implemented to allow their operative side to heal. Now, if you selected letter C, activity is restricted for several months. This is unnecessary because we know that they can resume their usual activities or normal activities after 5 to 6 weeks. Now, if you selected letter D, clients can resume normal activity and aerobic exercise soon after surgery. Soon after surgery makes the statement incorrect. This is not recommended because this can increase the intraocular pressure. Okay, so your focus, hang on a sec, what's going on? All right, let me go back to that one. Letter D, again, I think I already mentioned that one. So your strategy here is to select that option that will promote gradual recovery, gradual resumption of their physical activities. Okay. Eliminate those items that mentions item that can mention this one can be as active as they wish. What else? This is too much for letter C as well. Restricted for several months. This is unnecessary. And resuming aerobic exercise soon after surgery. This is considered as vigorous activity. So take that off as well. Number 11. What is the most important goal for a client who has had surgery to repair a detached retina? Is it A, control pain, B, prevent an increase in intraocular pressure, C, promote a low sodium diet, and D, maintain a darkened environment? Most important goal here is letter B, prevent an increase in the intraocular pressure. This is to prevent the complications and also to successfully allow healing over the operative site. Now, letter A, control pain. This is something that is also important to treat, right? To promote comfort, but this is not the priority after retinal detachment surgery. What we are looking for in this case is basically to prioritize that option that prevent serious complications. Now, if you selected letter C, promote a low sodium diet, this is something that is appropriate for patients that may have issues with hypertension, but not relevant in this case with post-retinal surgery. If you selected letter D, maintain a darkened environment, this might help promote comfort. It can reduce the eye strain, but this is not as a critical factor in the client's recovery. Compared it to with letter B, which is gonna be our utmost goal to promote healing. Let's have number 12. After a client undergoes retinal detachment surgery using gas tamponade, what is the first nursing intervention? Is it A, teach the signs of increased intraocular pressure? B, position the client as prescribed by the surgeon? C, assess the eye for signs of complications? Letter D, explain the importance of follow-up visits. So you are the nurse taking care of this patient. So what would be your initial nursing action after they had completed this gas tamponade? Is it A, is it B, C, or D? If you selected letter A, teach the signs of increased intraocular pressure, this is important, but you as the nurse taking care for this patient should initially assess the eye for signs of complications. The teaching can take place after. You should do this assessment first. If you selected letter B, position the client as prescribed by the surgeon. This is also critical for the healing after the gas tamponade, but you should do first the assessment, whether the patient is having any complication after the procedure. The positioning can take place after that. If you selected letter D, explain the importance of follow-up visits. This is also very important for long-term care, but this is not the first concern immediately after the surgery. Okay, so your role here as the nurse is to make sure you are looking for any manifestations of the possible complications that might arise after the gas tamponade. All right. Always do your assessment first. Teaching can take place after. The other actions, such as positioning the client as prescribed, and also teaching about follow-up visits, can happen later. Now let's have our number 13. After gas tamponade surgery for retinal detachment, what discharge instruction should the nurse give to the client? Is it A, the client must lie flat with the face down? B, the head of the bed must be elevated to 45 degrees? And C, the client should wear sunglasses when outside? And D, the client should avoid reading for 3 weeks. The correct answer here, it is letter A. After they complete this procedure, the patient must lie flat with the face down. Okay, this is similar to what I mentioned earlier about the retinal surgical procedure, retinopexy. And they're going to assume those specific position in order to allow the gas bubbles to float into the correct position to press against the retina. That is the purpose why they are going to be facing down after they get the gas tamponade. Okay, this is to again ensure that the gas bubbles float into the correct position to press against the retina. If you selected letter B, the head of the bed must be elevated 45 degrees. This is not recommended after gas tamponade because it can cause the gas bubble to shift away from the retinal tear. This is not going to enable the gas bubble to work its intended purpose. So elevation is not going to be applicable in this surgical procedure. Okay. Now, if you selected letter C, the client should wear sunglasses when outside. Do you think that this is appropriate? This is not really necessary after the gas tamponade because the procedure does not typically cause photophobia or photosensitivity. Okay, not required. If you selected letter D, the client should avoid reading for 3 weeks. There is no need to avoid reading for an extended period after the gas tamponade surgery. While there may be some activities that may be limited, let's say head movement or the bending aerobic exercises, these are things that should be avoided after the surgery, but not about this restriction, avoiding reading for 3 weeks. Okay. So our question here is asking about what would be the action that can impact the success of the gas tamponade. This is what the question is asking us. So the answer should be about the positioning in order to allow the gas bubbles to press against the detached retina. That is the purpose. Let's have number, or that's actually the last item before we end. So now let's talk about the differences of the three. We have the retinal hole, the retinal tear, and also the retinal detachment. So there are differences between the three. So if we are going to talk about the retinal hole, this is basically like a break inside or in the retina. And this is somewhat like a light sensitive layer of a tissue at the back of the eye, and these holes can actually create a gap in the retina, and this can also affect their vision. Now, what could potentially cause the retinal hole? This could be caused by aging, because when the person ages, the vitreous humor, which is the gel-like substance inside the eye, will start to shrink, and it will pull away from the retina, and it will lead to those small holes. It could be caused by trauma, wherein there is a direct damage to the retina, and also the degeneration of the vitreous, because over time the vitreous will become less firm. It can pull on the retina and it can weaken it, causing the holes. Now, if we are talking about the retinal tear, this is going to be like an irregular break. It could be jagged. It's not similar to the hole, which is smaller, right? This is typically larger, and this can be more prone to the complication. It can lead to the retinal detachment itself. So this is something that you need to keep in mind. Now, let's just take a look into this picture right here regarding the retinal tear and the retinal detachment. So there's that jagged appearance in the retina for the tear, while when we are worried about the retinal detachment, this is the pulling away of the retina from the choroid. Okay. Now, what will be the causes of the retinal tear? These are your posterior vitreous detachment, or known as the PVD. It could be trauma. Now, let's talk about the retinal detachment. This is the separation of the retina from the underlying tissue. And this is caused by the accumulation of fluid. It could be caused by trauma, or it could be caused by the severe retinal tear as well. Now, this time, let's talk about the different manifestations of the three. So, with a retinal hole, our patient might complain about flashes, or maybe they're going to experience floaters. And sometimes they may not have the manifestations. They could be asymptomatic. Most of them probably will complain about the blurring of the vision. And for the retinal tear, they're going to experience the flashes of light, or they'll see those floaters. They're going to be seeing the shadows as well. And they probably will tell you that, hey, I am seeing that curtain that obstructs their vision. Okay. Now, if you are going to have this patient with a retinal detachment, this is going to be reported as peripheral or central vision loss. This is going to be sudden. There's curtain-like shadow, flashes of light, and also presence of floaters in their visual field. Now, what is the risk of progression when we are talking about the retinal hole? This can progress into the retinal tear. Low risk for retinal detachment, but eventually this will lead into that if not treated. For the retinal tear, this is going to possibly progress into the retinal detachment, right? If there is that space that will be created, if it will start detaching from the choroid, then it can really worsen. Now, for retinal detachment, your patient here is at a higher risk to have that blindness, immediate visual loss. Now, let's talk about the activity restrictions that you should keep in mind between the three. There might be some similarities. So, if your patient has a retinal hole, you should instruct them about not lifting heavy objects, avoid straining, avoid vigorous physical activity. And for the retinal tear, they need to avoid straining their eyes, like extensive reading before the surgery, right? Or sewing. And also, you're going to educate your patient about limiting or not lifting heavy objects, also straining, vigorous physical activity, coughing. And for the retinal detachment, this is going to require emergent actions. It will require bed rest. You need to cover their eyes with the patches to limit eye movement, also to decrease IOP. We need to speak to the patient before we approach them in order to prevent startling them. Okay? We need to position their head as prescribed, not prone. This is before the surgery. We're going to have to prevent them from doing jerky head movements, because this can also lead to more detachment of the retina. We need to minimize eye stress, and we need to tell them to avoid vigorous physical activities such as heavy lifting and straining. So that would be your education. Now, let's talk about the pre-op nursing actions this time. Well, this will be applicable between the retinal hole, retinal tear, and retinal detachment. You need to obtain that signed consent, the form that is signed by the patient. Make sure that the medical provider or the surgeon has already discussed to them the risk and the benefits, the alternatives. Make sure that they do the informed consent first. Informed consent, and then we will follow up that with making sure that they signed, and then we will witness that consent. And if the patient will require general anesthesia, they will be kept NPO at least 6 to 8 hours before the surgery. We're going to have to administer those pre-op meds as well. Now, for the treatment, here are the following. The treatment for the retinal hole can include the laser photocoagulation and also the cryopexy. So the retinal photocoagulation basically is like this. So the laser will be done to create, it will focus those beams of light to create small burns into the retina. And this is to cause scarring. It will help seal the retina to the underlying tissue. Again, the beams will be intended to cause scarring in order that the retina will attach back into the underlying tissue in order to prevent further fluid accumulation and for further detachment. Now, for the cryopexy, with the word cryopexy, this is going to involve the use of a cold. This is going to allow freezing the area around the retinal hole or the tear. And the freezing of that area can actually lead to an inflammatory response that will help the retina to attach to the underlying choroid. Okay, it can also promote healing. Now, let's talk about the retinal tear. It's also going to require the same procedures, laser photocoagulation and also cryopexy. However, for the retinal detachment, this will require the pneumatic retinopexy, which is something that I already mentioned earlier. So this is basically a minimally invasive surgical procedure. It involves the use of the gas bubble, and this is going to be injected into the vitreous body or the vitreous cavity to push the detached retina back into the underlying tissue. So let me just to focus on that one. So there's formation of the gas bubbles. And remember about what I said after the procedure, the patient will be placed on a supine position, or maybe their head will be tilted or lateral in order to allow the bubbles to push into the detached retina back into place. Okay. Now, another procedure that is expected or could be the option for this this condition is the scleral buckling. What is this? Scleral buckling is basically this one. So this is more of a silicone-based type of product. And so this is a surgical procedure with the application of a silicone band. It's placed around the eye to indent the wall of the eye. So it will relieve the traction on the retina. And so the purpose of this procedure is to allow the retina to reattach. It will cause pushing it against the underlying choroid. And this is also combined with other techniques or surgical procedure, such as laser treatment or like cryopexy. Okay. Now let's have another possible surgical procedure. We have the vitrectomy, which is this one. That's the vitrectomy. So this is going to involve the removal of the vitreous gel from the eye. And this is to relieve traction on the retina. And it's going to be used with other treatments to repair the retinal detachment. And it's also going to involve possibly with the other procedure, injection of the gas bubble to support the retina. Now, similar to the pneumatic retinopexy is what we call as the gas tamponade. The gas tamponade is going to involve a much more extensive procedure. It's quite similar to the pneumatic retinopexy, but here it can be done together with the other procedures like vitrectomy, could be done together with a pneumatic retinopexy. And the purpose basically here is to provide support, and this will also help hold the retina into place while the retina is healing. So the bubble gradually absorbs over time. Okay. Now, this time we'll talk about the post-op nursing actions, which is something that you should internalize. This is going to possibly come out in your test. So you want to make sure that the patient wear the eye patches as directed. Maybe in some instances, in other procedures, this might not really require the reapplication of the patch, but generally, if there is an order, specific order to keep the eye patches on, then we need to follow that medical provider order. We also need to make sure that we are watching for any signs of bleeding. We're going to have to prevent nausea and vomiting, and we need to check for any restlessness, as this can lead to more bleeding. Nausea and vomiting, this can also increase the intraocular pressure. We also need to check for any sudden sharp pain in the eye. This is signaling that there is increasing IOP. We need to encourage deep breathing, but to avoid coughing. This is something that you should take note. No coughing, as this can lead to increasing IOP. And we want to make sure that our patient is doing that bed rest as instructed. And we also need to position the patient as ordered based on the detachment site. So for example, if we were talking about the gas bubble injection, they're going to be placed on a prone position, right? Or the retinopexy. So this will allow the bubbles to push against the detached retina. All right. Now we also need to administer the eye medications as prescribed. Those eye drops are very important. Also assisting them with the daily activities, and we need to avoid or teach them to avoid those sudden head movements or any activities that could potentially increase the intraocular pressure. Bending, aerobic exercises, coughing, lifting heavy objects greater than or equal to 10 pounds. Now, also limit reading for 3 to 5 weeks. Okay, this is very important. We also need to teach our patient to avoid squinting, straining, constipation, heavy lifting. I've said that already, bending. We also instruct the patient to wear dark glasses during the day and an eye patch at night. So this is not really the main actions, but this might help the patient, okay, to at least minimize some photophobia in some other surgical procedures, but it's not going to be applicable on all those procedures that I had mentioned. Now, we are going to also encourage follow-up care for recurrence risk. Make sure that our patient shows up for their required appointments. Now, I hope that you are learning from this discussion about the retinal detachment and the similar conditions such as the retinal tear or holes. And I hope that you are also able to absorb those important concepts. And again, I hope that you also gained some insight on how to properly attack the test question and also how to strategize your responses to these test questions. And please don't forget to like this video if you find this video helpful, and don't forget to subscribe to this channel. And also, we are encouraging you to enroll to our NCLEX review at stankosnclexcoaching.com. So we'll see you in the next one. Again, thank you so much. You take care.